All right. Well, thanks so much for doing this. My first question to you is tell the audience a little bit about yourself and how you started in the community, the mental health community.
Yeah, hi. A little bit about myself. I I don't even know what to tell you. I'm born raised from Ohio. I live in the Cincinnati area. Um, I went to Ohio State and just fell in love with psychology after I'd taken my Psychology 101 course. Always had an interest in people and serving others and just being kind of active and connected with people in that way. And one thing led to the next, and it kind of led me towards psychology, brought me to Cincinnati for graduate school. And then I became a psychologist.
Mm-hmm. So what is it that you do in your current role?
In my current role, I work in an outpatient, well, I work in a group private practice, so out in the community. So I do individual therapy. So for people like you and me who are living out, out and about in the community, I see them as they may need or benefit from.
Mm-hmm. So, what sorts of modalities do you use as a mental health professional?
Oh, so like cognitive behavioral therapy would be, everything sort of anchored in that and rooted and grounded in kind of that mode of intervention, like looking to explore our thoughts, our feelings, how those interact. Um, Also work within like I guess the interpersonal realm or the emotional realm. I don't mean to say those are like separate, they're all connected, but also using those types of techniques so that we can access some of those tensions and work through them together in safety.
Mm-hmm. So, is there like a particular modality that you use more frequently, or is cognitive behavioral therapy kind of like the main one?
I guess I'm an integrationist. I use them fluidly. And so it's all going to be based on someone's needs. And so someone may need more in that moment to explore their feelings and to deepen in that and to maybe understand it, not avoid it, as we all tend to kind of do with some of those feelings. Um, Others may be in a space where there may be certain changes or shifts they can make in their life, like within their behavior or certain thoughts. And so, like, kind of pending what the need is where we go.
Mm-hmm. What are the
Yeah.
therapy sessions like? When you're with a patient, how does it usually start?
It really usually starts with, hi, we sit down. Um, when I meet with a client there's some type of kind of like breaking the air, I mean, it's a vulnerable relationship. People are coming and meeting me for the first time, and it's an honor, and it's also challenging. So I'm really working to get to know people, hopefully making it a comfortable place rather than this stuffy sort of setting that we've come to find doctors' offices as, and just really work to make it really personal and human. And I guess I also think that's the power of therapy. It's not also just in the technique, it's how we show up for each other.
Mm-hmm. So,
Yeah.
like, what are when you're working with patients, what are some of the common themes that you sort of see when people come in and tell you, I have this going on, I have this problem, so on and so forth?
Some of the common themes that I see in folks. I mean, lots of struggles are universal. And I guess one common theme that the more and more I become a therapist, I start to understand that a bit more, and how each of us often think we are really alone in the world. And so a common theme often in therapy is actually working to make space for these real experiences we're all having, that somewhere along the way we were told to be shameful of or became shameful of, wanted to hide, didn't think we were good enough, right? So it's oftentimes like this extra layer of thought about it. And so that's often a big theme that kind of everybody goes through, right? Like, why is this happening to me and it shouldn't be here? And so we often confront that, acceptance of that, and then kind of work through to start to try to see the world differently. And I think for everyone, therapy at some level is about trying to see things from a perspective that you don't naturally take. And it's almost an invitation for that. And so for all of us, we kind of are working to do that together. And I'm trying to help support that.
Mm-hmm. How do you, as a therapist, make clients feel seen and heard? Because oftentimes, when people are looking for a therapist, they often are trying to find that fit, between a client, practitioner and client, and that's not always the case. So, like, how do you make them feel, I guess, seen, heard, understood?
Those are all good questions. And in like many ways, and I may go off on a tangent, so feel free to redirect me, right? They can be in opposition. And so I think you have to be willing to show up, actually listen, take away your blinders and enter that space and be willing to be genuine. And so when you do that, then that natural fit may come or it may not be there, but maybe that's okay. So yeah, I mean, I guess, it's a business, right? There's a bit of sales and whatnot for sure, but I think that's not the most important piece, right? Just being yourself and doing the work, and then some hopefully those vibes and those relationships kind of established if they make sense to. Ways I work to build that are to lean in, are to keep my mouth shut, um, are to listen more, to not make assumptions, um, to understand that the person in front of me is the expert, truly, and to operate from that perspective as well.
Mm-hmm. So, like, I always ask therapists this when I invite them on podcasts, like, what have you learned in terms of, as a clinician, what have you learned, doing this kind of work?
What have I learned doing this type of work?
Mm-hmm.
You're asking really good questions. I'm not used to these types of things or being the one asked the question. So, will you repeat that again? Though, what have I learned?
What have I learned? What have you learned as a mental health professional? Yeah.
I think that, like, as the biggest lesson I've learned so far as a mental health professional, and as a human, a life lesson for me as well, is that people's circumstances are not always within their control, and in fact, much of life is not. And so, the more we can really come to like respect that, honor it with kindness and dignity for everyone, I think we would get along much better in so many ways within ourselves, with each other. Um, so yeah, that's a big lesson I've learned.
Mm-hmm. What do you hope to learn in terms of something new as a mental health professional? Is there something in the mental health realm that you want to explore further that you're like, I'm curious about this, I want to explore this?
So much, it's hard to answer that question. But right now I am in this space of looking into attachment theory and really wanting to dig more into relationships and styles and how we relate to each other and how we come to kind of connect and belong together, how that feels, how that can be good for us, and how that also what kind of may pull us in directions that aren't so good for us.
Mm-hmm. So I guess my last question is what can people take away from this conversation? How can really mental health be sort of a gateway for people to find or seek that help, for people that are struggling, going through issues?
How I just want to repeat it to make sure I understood what can people get from mental health?
Yeah,
What may be in it for
what can
someone?
people get from, counseling mental health, and like, because oftentimes, people are going through struggles and phases in their life, transitions.
Oh yeah. Um, what can people get from mental health? I start to think about it all sorts of different layers, and I think like generally like broad stroke, what people may be able to get and achieve, if not, even more specific to each of them once they get into it, is hopefully a deeper understanding of themselves. Um, Perhaps starting to be able to feel comfortable with somebody else in a vulnerable way for the first time, to start to take risks with support that they didn't know that they could and that are rewarding. Um, what else can someone expect? Hopefully, like with that, some I want to say peace of mind, but I guess we're all coming for it for different things. Not everyone's coming for peace of mind, but maybe like centering within themselves and confidence in their next steps.
Mm-hmm. All right.